Good afternoon, everyone. I'm Dr. Karim Kurji, York Region's Medical Officer of Health, and I would like to, at the very outset, acknowledge the support we have received from the provincial and federal governments, and I particularly want to acknowledge the support of my Regional Council, Chairman Emerson, and Regional Council of the Municipality of York, who are our Board of Health members. So, I wanted to start out by giving you a quick update on the status of COVID-19 in York Region. So I have some good news and I have some bad news. The good news is, of the 6 cases that we were following up, 1 individual is now asymptomatic. Before we clear this individual, we need to have taken 2 sets of swabs, and we're expecting that to be done within the next day or 2. So that's the good news. The bad news is that we have 1 more case. This is a 64-year-old lady, a resident of Richmond Hill, who has arrived in Canada on March the 2nd and is now in isolation. We are still working up the close contacts for this particular recent arrival, and our investigators are working on this since the result was just received about an hour ago. I'd like to let you know that we have followed up on some 60 casual contacts and 17 close contacts. 8 of the close contacts are being followed up by Toronto Public Health, with whom we work very closely in our investigations. 1 of these close contacts has turned out to be negative, and we're still awaiting results on the others. Now, I appreciate that there continues to be a level of anxiety amongst the public, but I want to reassure you again that unlike many countries in the world, we have avoided community transmission and the risk still remains low. Now, how do we know that there is no virus circulating in our communities? Well, we have investigated some 364 persons under investigation, and we've had test results from those, and those have been negative. Some of those individuals were referred by clinicians. Some of those individuals were referred by clinicians when they didn't have any symptoms at all. And so it is comforting to note that even those individuals turned out to be negative. In addition to that, we know that the province has implemented a surveillance program with some hospitals in the Toronto region, and they have already tested some 300 individuals, and all these tests have come negative. Now, in an ideal world, we would like to have at least one of our hospitals to be part of this surveillance program, where the specimens that they're taking for influenza would then be tested for COVID-19. Well, I have some good news for you, in that Public Health Ontario has informed us that they are working with Mackenzie Health in order to enable that to occur. Now, whilst we don't actually have any evidence of the virus circulating in our community, what we are seeing though is folks, usually returning residents, who may be bringing the virus back from affected countries in the world. The situation in the rest of the world isn't as favorable, and if I could just break down the 7 cases that we now have, 4 of those have come from Iran, and 3 of them have come from Egypt. In fact, we in York Region seem to have more cases than Egypt has in Egypt, but we have identified that the cause of the Egyptian cases is likely to be a cluster that was associated with a boat tour in Egypt. And we have been working with our colleagues in Toronto Public Health, with Public Health Ontario, and with the Chief Medical Officer of Health with respect to liaising with another country whose residents were also on this boat trip. Now, today's session is primarily geared to faith and community leaders who have to plan celebratory events, be it the Persian New Year or Nowruz, the Baha'i New Year, or even Easter and Passover that is rapidly approaching. As a former Minister of Religion myself, I know the challenges that one has to encounter, and I know the difficulties of the process. So I hope that we will be able to share some pointers for you to consider in arriving at your decisions. We already know that some of the communities in York regions are themselves concerned about the risk to their congregants and have already taken steps to reduce those risks. We thank them and request the others also to mitigate their risks. So where does this risk come from if we are saying that there is no circulating virus? Well, the main risk comes from somebody breaking self-isolation and coming into this large event that one may have organized. This can happen because a person didn't fully understand their responsibilities during self-isolation, as may happen with language barriers, or it may happen for other reasons. Unfortunately, we do not have a 100% assurance that every traveler from a high-risk place, the newest being Iran, definitely observes the 14-day period of self-isolation, even though we may be calling them frequently. We know from our experiences that York Region residents have taken the protection of society and their duties to society very seriously. And in fact, many of us have been pleasantly surprised at how diligent they have been in terms of avoiding exposures to the community. Also, since a country like Iran has just been added to the list of high-risk countries, those that traveled here recently may not necessarily be observing that requirement. Now, the Public Health Agency of Canada has produced an excellent risk assessment tool, and I wish to take you through the process that they suggest that you can use to reduce those risks. This particular tool is expected to be on the website soon. So first of all, good persons attending the event have traveled in the last 14 days from an affected country. Are you unwittingly inviting recently arrived performers from those countries? Are many people attending your event older people? Remember, older people with other ailments are more vulnerable, and we really have a duty to protect them. How many people are attending? If the number is large, there is a greater likelihood that somebody might possibly have COVID-19 and be amongst that congregation. We also have to look at our resources within the healthcare system. Many of us may not be able to handle having to do contacts and case investigations on very large numbers of individuals. And that would be a great strain on our resources. There may also be strain on the lab resources as far as testing goes, and there will be strains on the healthcare system in general. Also, a large number of those members of your congregations may well go into self-isolation or self-monitoring for symptoms and signs, depending on what transpires from the investigations that follow. Are you having activities that increase transmission by sick people? For example, activities like singing. When an infectious individual sings, it is possible that the droplets may go way beyond the immediate vicinity of that individual. Are you sharing food? If a sick person coughs on a buffet, it is possible that we may have a problem. Now let me take you through some mitigating strategies. So the first one is to reduce the numbers. If you reduce the numbers of people attending, the chances of having somebody with COVID-19 go down, and there are less people for us to follow up if something goes wrong, and the healthcare system also has less of a burden if something goes wrong. You could split the event into 2 to 3 days to keep the numbers low. You could keep the session short because it reduces the time for exposures to occur, and you would avoid crowding and spacing out participants, and that would actually help. Strictly speaking, a radius of 2 meters is suggested. However, that may not be completely practical, so we have to go with the best we can. One would need to replace buffet-style foods with packaged foods. We would ask vulnerable older adults to stay at home. We would communicate in advance the message that those that haven't completed the 14-day isolation period must not attend. And you would be expected to communicate that those who are sick should stay at home. We would need to increase the access to hand washing stations and to promote the personal protective practices that we have been advocating for. This is the respiratory etiquette and the hand hygiene. And you may consider offering virtual or live-streamed activities instead. You might even want to change the program to reduce high-risk activities like singing. And you may want to have a mechanism for us in public health to be able to reach all participants if there is a problem. So after consideration of all these factors, you may decide to modify or postpone the large event. We hope that this session, with the accompanying tools produced by Public Health Agency of Canada, will help you reach the right decision at this time. And we thank you for all your help in this matter. We are partners in keeping our community safe, and I'm sure we can count on your support. Thank you. I'd be happy to take any questions if there were any questions. But we are available for any consultations should these be required. Thank you. Okay. Thank you.
Thank you, Dr. Kurji. We just encourage if people have questions to visit our website at york.ca/COVID-19, and that is a trusted source of information, and it is updated regularly and daily. Thank you.